San has taken on a lead role in our efforts to improve our patient satisfaction and has done that for the last 7 years, and her energy and enthusiasm, I would say her natural energy and her natural enthusiasm for that lends itself to her doing that job, and she's passionate about it, and she brings that same energy to that part of her job that she does with the clinical part of her job, and I think everybody appreciates what she does in that regard.
Facilities this size don't always have a certified diabetes educator, so I was with her and pushed her, and she got that like many years ago, and she keeps current with scientific literature. She's helped us with many protocols, supplemental insulin protocols. Recently we changed to a correctional dose insulin protocols, educating the nurses, the patients, and most of all the physicians on how currently we practice using insulin in our facility.
San's very knowledgeable. She is a continuous learner. She has stayed abreast of the changes in the healthcare, changes in the medical advances of diabetes, and that sort of information she has taken and broken it down till it's understandable for patients and families. She's been there for people, and I know of a couple of patients, actually one little girl who was born and soon after found out that she had type 1 diabetes, and San cared for her up until she was in her early 30s when she died. But it's been like a progression and a fellowship, you want to call it, or an accountability with patients to the hospital to take care of themselves. So it's been good.
Well, she's a great resource, I think, for the patients in our area that do have diabetes or have been diagnosed newly with diabetes. She is able to get insulin for folks that couldn't afford it, which is obviously very important. They would get sicker and they might find themselves in the hospital more often if they didn't get the insulin that they need, or the teaching that goes along with it so that they know how to take care of themselves with this new diagnosis in a lot of cases. Her involvement in our health fairs, both in this county and outlying counties, is very important because not only does she provide the diabetes education and the screening, the initial screenings, she does other screenings while we're at these health fairs. So she's part of our outreach efforts, and I think that's just her nature. She's one of the first people to get in line and say, you know, I'm there, let's go.
Well, you know, diabetes is a very expensive disease to maintain, and a lot of patients do not have the resources. And we in Thomaston, in our areas, we don't have free clinics for patients to attend. So the free classes are a great benefit for patients, plus the option where we receive funds that we can provide them with free insulin is also a great bonus. I know that she works with some of the product reps to see if she can get patients glucometers, or to measure their blood sugar so that they can manage their disease, which is a great benefit for patients.
Thank you, Georgia Hospital Association, for this award. It is certainly an honor, and this is an humbling event. There are many people I should thank who have been with me through my career and inspired that career. First of all, my parents, my family, my husband and my children, who have tolerated lots of wacky hours during the years, and all who have been a point of inspiration for me and doing what I have loved to do these years. Upson Regional Medical Center, I looked at as a little girl and had the dream of working here one day, so it's been an honor to work among great people and do great work with them. And those staff include physicians and nurses, as well as other staff people at Upson Regional. Special thanks to those who nominated me for this award. And finally, and probably most importantly, thanks to the patients that I have had the privilege of working with and caring for through the years. I've learned so much from my patients and have been blessed by having those relationships. So I have a lot to be thankful for, and I do appreciate this award. Thank you.